Hi guys, this is Dr. Bigmas with Public Health Talks. And on today's show, I will be talking about grief and mental health. And I have a friend with me, a sister and a colleague that will help me facilitate the discussion, and the person of Miss Risqat Anifowoshe. I want to welcome you to the show. Thanks for joining me today.
Thank you for inviting me.
Yeah, so a brief bio of Miss Risqat. Like I said, she's a friend and a sister. She's a mother to 4 beautiful children. She loves volunteering during her free time. And she holds a master's in education. And she has extensive background in educating high schoolers and preschoolers and their parents to groom future leaders. Again, thank you so much for joining me on today's episode of Public Health Talk series.
Thank you. You're welcome.
Yeah. So, like I said, today's show will be focusing on grief and mental health. Grief, as we know, is a normal and a healthy reaction that occurs when you lose someone or something that's very important. And sometimes it is possible to delay grieving process, but however, it's not possible to actually avoid it altogether. So on that note, as someone that who recently lost a loved one, a husband to be specific, so what does grief mean to you?
Well, grief actually, they would say is a reaction to when you lose something or you lose someone. To me, it is and it is not, because it's not just the reaction, it is like a lifelong thing that you feel. It just continues on and on. There is no stopping. So you are bereaved, you feel the pain, but then you still have some other things going on in your life and you have to keep on with those things. At the same time, holding the pain in your heart, you can't actually talk to people about it. You can talk, but there is a limit to what you can say. So to each its own. So it's grieving is just, to me, it is continuous. Like there is no end to it as long as that void is there. And some people will be like, oh, yeah, you can replace something or someone, but it's not going to be the same thing that you lost that you are going to feel the void. So the void is still there. And as long as that void is there, you are still grieving. Like it's a continuous process. It's, to me, it's unending.
Okay, so like you mentioned that, yeah, I think I agree with you that people can never understand how you feel unless they're in your shoe. But wouldn't you agree that it will be better to talk to someone, about how you're feeling, that it will help ease the pain a little bit, or for you, it doesn't make any difference?
Well, it helps in at least so you don't go crazy. You have somebody trusted that you can share your feelings with and how you feel. But at the same time, I feel like there are just some things you can't explain because it's not something that happens once. There are times you may be going through stuff and you see these things and you feel like, oh my goodness. Then the memories come back again. Like you can't run to people every time. It is okay to have somebody that you can open up to. It helps. It helps to clear your perception about grieving and about bereavement, everything. But then it helps in a way, but it's not absolute.
So how has grief or the grieving process affected your mental and physical health?
Mental. And well, to God be the glory. I don't know where I got the strength, but I feel like I'm able to still hold up and still move, even though I'm running crazy inside. I'm still, when they say your own threshold is different from somebody else. So maybe I am lucky to be able to have all those things bottled inside me and still move on, right? But not everybody has it. But mentally, at times, okay, let me share this with you. Not long after my husband passed, a friend's mother also passed, and in similar circumstance. And when I went to see the friend, probably I was thinking, aloud. And then I just said, because I saw the woman like few days before she eventually passed. I said, if I knew she would pass so soon, maybe I would have sent her to my husband. You know, like when I
that, you know.
you know, and people around me were like, look at my sister, what are you thinking? I know it sounds crazy, but you know, that is how crazy you can be thinking of such things. And there are times I will be in the closet and I'll be like, I hope it just show up like just one time, just for me to sing for the last time before he finally, you know, exits. But I also think if I see him there, how would I respond? So mentally, you can imagine those like ridiculous thinking you are having, even though you know it's not possible, but you still have this thinking, like these thoughts going on in your brain, like, oh, I hope this is possible. I hope I can just have a glimpse of him, you know. So, but I am holding on. I'm just like forging ahead, but there are times it's like I would break down, like I will literally cry and cry, you know, crying actually helps.
Yeah.
So I'll cry and I'll talk to myself, okay, you can't do this, the kids can't see you in this way. So I feel like mentally I have been really affected, but somehow I'm still able to cope. So physically, I'm good. I'm just, at times I don't bother about me, you know, like if it was there, I'll be like, oh, you have this, you should do this. But at times I would just be like, don't need. Then at times I'll feel like it wouldn't want that for me. I still have to do this. So those remembrance of fond memories actually help, you know, give the strength to kind of move on.
I think, you know, like you said, nobody can ever understand the pain. But from my own point of view, I think, you know, if you want to cry, cry. You know, cry. It's okay to let it out. You know, I think that's part of the process. And like you said, it's a process. It's going to be a lifetime process because you can never fill that void. You know,
Okay.
so especially when you lose something important or someone important to you. So like I said earlier, you have four beautiful children that I've met. You know, I think they're fantastic, you know, well mannered and everything. I don't know how you do this, you know. Um, so how has this process changed your family dynamic and your perspective on things in life generally?
Well, thank God for the spouse I had. Like we never knew it was going to be like this. So we've been doing things together, like raising the kids with one voice, and that has actually helped. You know, whenever I say something or I tell the kids stuff, go do this, go do that, they may not like it. And then when they go to their dad, they realize, okay, it's the same thing, you know, like it's still the same voice. So that actually helped to move on with them because I've always been in charge. It's not like it is always them listening to their dad and not me. If they realize there is nowhere to run, like whatever you get from A is what you're going to get from B. So that, in a way, actually set the strong foundation for us to move on when it was no longer available. And the kids too are having their own issue. Like I can't imagine at times what goes on in their head, just as I do have stuff going on in my head too. But you will have this random talk, random question, random observation. Even today, the youngest, who was 2 when he passed, was like, we lost our daddy, right? I said, yeah. And we are going to meet later, yeah. I said, when we grow older, okay, when I grow taller and grow taller than you, I said, yeah. And we are going to see him again, yes. You know, for her to say that how, you know, I don't know, maybe it's just random, maybe it's just some, you know, some troubling in her mind about, okay, these people have dad, or where is my dad, or she saw something that reminded her of her dad. And that goes on with the other ones too. So, but because of the firm foundation that we have, and then the religious belief too, like we do talk a lot, we don't hide stuff. Even when the dad was sick, I would always explain to them, we got to pray, it's been taken care of in the hospital, but it can be this way or this way. You know, I don't hide the fact that it can lead to what it led to. So that actually helped them when eventually happened, because even one asked me then, okay, we are praying. He said like, okay, what comes, if our prayer is not answered, so what happened? I said, well, there is no prayer that is not answered. It may not be the way we want it, but we just have to continue to pray. And because I don't know why he had that question. Like, we were at his bedside when we were about leaving, and we prayed, we were going to turn and say, okay, what if prayer doesn't work? What happens next? I said, well, it happens. Prayer always works. It may not be what we wanted. You know, like, I don't try to sugarcoat it for them in a way so it doesn't shock them when eventually happens. Like, they already have a glimpse of it may be this way or that way. So that in its way actually also helped for us to kind of forge ahead.
Okay. So, like, I mean, your kids are 10, age 10 and below. You know, you just spoke of your youngest one, who she's 4. And I mean, it's amazing how children think, especially like, like you say, you can never understand what's going on in their head. I guess maybe what she's seeing around her, that's how she's putting the pictures together in her head and she's expressing it to you. So, like, how would you say, how important is support system during the challenge, this challenging period for you?
Oh my goodness. Like, I can't just, it cannot be underestimated. Sincerely, like, it is very good, very essential, very important. Like, I don't know what adjective to use, but it is very good to have a very good support system, be it family members, friends, social group, religious community. Like, it is just absolute. That in a way has actually kind of been like a backbone at the moment, because then, oh my goodness, even till now, they are still there asking about you, helping in every way. So there is nothing like having a very good support system when you have been bereaved or you have something going on in your life. It is like top notch that you just have to, like, it's a must. And I pray everybody, that anyone that has been in such situation or would be in such situation would have like the kind of support system or even better than the one I have, because they have really been very helpful. Till now, they have always been there. You just have to talk to them, like, call them, they are always there. Even when you don't request, you just see them helping out.
Yeah, because in this kind of situation, any other situation for that matter, like, having that support system sort of like help heal. It helps with the healing process, during the challenges, this challenging period. So you mentioned how, the kids, they've been asking questions, especially of late. So how have you been helping them to hold on to the memories of their dad?
Well, we have videos, like, I have lots of videos. I'm even trying to see a way to preserve them. I have preserved them. I have picture books, from the one we have on our phone. We make them into picture books. They would, but at times I feel uncomfortable when they are going through those books, because they start to ask questions. They start remembering, like, you make a turning on the road, and they'll be like, oh, I remember Daddy used to take us this way. And I'll be like, oh my God. So whenever they are turning those books, looking through, and there is a particular video on his phone while he was lying on the bed, hospital bed. He was advising them. The youngest, the youngest, actually know. And she will be like, I want to see the doctor. And doctor being like hospital bed stuff, So I want to see the doctor and Daddy on his phone. And he was very sick then. I really don't want her to look at that video.
Yeah.
At a point, I have to move the video and put a code on the phone, because whenever she goes on that phone, that is where she is going. She just wants to play it. As much as I'm trying to preserve it for them, I also don't want them to go look every time. Like, I have, and because it brings a lot of questions and memories, and you have to explain in a way for them to
Understand.
Yeah, it's a lot.
Yeah, I think it will just be good, in a way to find that common ground where, they will be able to watch the video and feel comfortable, and you'll be comfortable them watching the video. So this way they'll have that long lasting memory of their father. Or, like, I don't know how you think about, about that.
Yeah, there is one video they do watch, but that one, because it's on lying on his hospital bed, it was close to the end.
Yeah.
So I really don't want them. But there's another one where they were eating together or something. They would watch that. They would scroll through. They would, because they eventually will come back to me to ask a lot of questions.
Yeah, absolutely. Yeah, I mean, they're just curious. They wanted to know what happened. So I think it's just normal. It's part of the whole process for them as well. So, but most importantly, how are you doing? And how are you coping with everything? Because, I mean, we talk about the mental health aspect of it, the physical aspect out of it, but we need to know how you're coping and how you're dealing with everything, how you're doing.
I'm good. I have good friends. I have family. His family have also been helpful. His mom is still alive. She would call, even though I rarely call her. She would call and ask after us. The siblings, most of the siblings would call me and, chat, talk with the kids. And I'm good. It's just that at times I'm pained. Like, it, when you lose something and it's not just anything, right? When you remember the kind of person that person was, the stress you are going through now, and
You can take a minute. Yeah, because I can see you choking up there. Yeah.
yeah, there are some things I don't do when he was alive, right? But I got to do them now.
Yeah.
There are some physical things I really don't do. Be like, oh, I know you are not really strong. It will be the one to do it, right? But now I have to. Of course, there are people helping, but I can't call on people to do that for me every day. They never complain, but you still want to retain some level of your own privacy too. You want to respect those people too. You don't want to tell them to just errand boys. So there are times I'll be doing things and I'll be like, oh my goodness, I don't do this. Like it will be the one to do it. Even if I do it, to be like, oh, I didn't ask you to do that. I know you can't do it, but now I got to do it. So that in its own is really difficult. Even to the extent, the dispenser water bottle, before it passed, I had no reason to lift that bottle up. Never had. He is always the one getting it. So we use dispenser. It has to be refilled. People helped me, but come on, I won't call them for life to do it. So I have to just summon this strength. At a point, my arm was hurting. I was using braces just because I've been lifting stuff I'm not used to lifting. So in such instances, like you kind of feel like it's just that kind of a person that you would always miss him because he's just a good person. I feel like he's even a better person than I am, sincerely.
Yeah, so because I mean now you're playing the role of a mom and a dad, basically. So which at times, for us playing the role as a mom is it's difficult as it is. So because of having to play both roles. So I can see how every time you're doing both, you're playing both roles, right? You're remembering the things that that you would do when it was here.
Yeah, personally, I don't like going out. Like, I'm an indoor person. But I can't deny the kids, this opportunity of mixing, of going out. I usually push it to him, like, okay, go. Even grocery. Oh, he's coming back from the mosque. When you're coming, can you drop by at Walmart or something and get us this? That is no more. I just have to find a way, to put that in my schedule. And the kids also want to mix with their friends. They want to do this. Usually I will push it to him like, okay, you take them, I will hold back here. He doesn't like going out as much, but he doesn't mind doing it, taking the kids out, he plays with them. And that is just kind of difficult for me. And thankfully that he did it right. The kids have such memories of what he was doing with them. And that is very essential. It's not just about getting the money for the home. You also want to have time for your kids because you never know.
Yes, you never know. Absolutely. I think that's the key right there. You never know. So you just have to find that time to spend with them because you never know. You might be here tomorrow and not be here. You might be here today and not be here tomorrow. So, yeah. So, but what would you tell anyone in a similar situation as you? What kind of advice would you give them?
Well, I know it may be similar situation, but we are different people.
Mm-hmm.
So, and different personality. So once we just have to summon, the person just have to summon up that courage to move on, because you are still alive, and the person that you lost would actually want you to move on.
Mm-hmm.
Get a grip of your life. Look at the fond memories that you shared. Just get strength from such fond memories to start moving on, one step at a time, one step at a time. Use the support system that you have. Like, don't say, I am super strong, I'm a superwoman. Well, you cannot underestimate the power of having people around you. The support system, if you have it, please make use of it. It is very, very important. And as much as I would say grieving is not going to end, we just have to have like garner this strength to manage it well, so we don't be like a shadow of ourselves. You have to be able to manage it in such a way that you don't break down. You are not dead when you are still alive. You still want to be able to make very good use of yourself, and especially when you have kids, you want to be 110% ready for them. So we should find a way to balance whatever we are feeling, whatever we are going through, balance it up, and remember how much fond memories of the person that you lost. Get your strength in it. And if you are a person of faith, well, for me, I am a very, like, I am a person of faith, right? So, and I believe after every difficulty, as it is said in Quran, there is ease. So that is kind of whatever I'm going through, I'll be like, okay, it's just for a time, it's for a while, I'm moving on. I'll like, this too shall pass.
Shall pass, absolutely.
Yeah.
Mm-hmm. Yeah. So, I mean, I know you're very busy, a working mom, a teacher. So how do you create with 4 kids, 10 and under? I mean, like, how do you create time for yourself? Because I mean, being a mom alone is like a never-ending job. And, how do you create time for yourself?
That I cannot have an answer to it, because one, like, my life now centers around those kids. And because I'm also a teacher, it's like you are teaching 24 hours. So that in itself is very tasking and stressful. At times, I try to see if I can just sneak out a few minutes, just to clear your mind. It's just not easy. Like, it's sincerely, I'm not doing well at that place. I'm able to manage myself so as not to break down, but being able to create time for me, for fun, not as much.
Okay.
Not as much.
Okay. So maybe we need to have like a girls' night out or something.
I don't know. At times, and that is another thing, at times you want to have fun and you have this guilt.
Oh,
As if,
okay.
like, why should you have, like, should you have it? Like, so I do battle that, because at times I feel as if maybe it's just a lot. Like, as if there is some inadequacy, or there are some inadequacies when it passed. Maybe if we had done this, like those thinking. So at times I kind of beat myself. Like, should you even do this to you? You should even enjoy this, should you? But somehow I'm also able to talk myself out of it. Like, okay, whatever is destined, well, you have no control over it. So when I have that thought up to that point, it helps me to kind of move on. Like, okay, stop. Don't think along that line.
Yeah.
What it's just meant to be.
You just told people in similar situation now that, find a way to balance. Yeah, right?
Yeah.
So you need to remember that. Yeah.
That is what I'm saying. Like, those thoughts would come up, right? It just depends on how you are able to push it down. Yes. It will definitely come up. Like, you may start like guilt, shaming yourself or feeling maybe if you have done this, it wouldn't have been this. But somehow I'm also able to get to that point where I would talk to myself. I don't know where I have that strength sincerely, but I know I do. Like I would actually tell myself, now stop. No, you have no control over it. You did all that you can possibly do. Like it's not actually not in your hand to say who lives or who died, right? So I'm able to like make that help for me. So that helped me to kind of, okay, let's go, let's do this. It's just I'm just busy. So
Yeah. So I think that I mean, in addition to what you just said, it's a long life thing. It's just a matter of someone the courage or the strength to be able to like forge ahead. And I think you know we have to be careful about suppressing our feelings, right? So because that's like a fine line, that we don't want to walk, right? In terms of letting it out and suppress, because if you suppress it too much, right, you don't know when everything's just going to blow out, and sometimes it might not be good. Sometimes, so if you have somebody that you're close with, it's always good to share whatever you're feeling at the time. So this way, which brings me to like, the reason why I wanted to talk about this is that I personally believe that, when people are going through this kind of stuff or whatever events that happen in one's life, talking about it, is one of the many ways to sort of like get through it. So I just want to know if this has done anything like a talk, because I know you get choked up, during some of your this earlier discussion, on this, like if it's helped at all in terms of talking about it and reliving some of the event that happened leading to your husband's death.
yeah, it's sure this sincerely, it's good to talk about whenever, no matter the issue, whenever something is wrong with you, it is actually good to talk about it. Like I believe so much in talking about issues. It helps to ease the burden on your mind. Of course, you cannot talk about everything at one time. You may talk about some part today, in some days or weeks, you hit another part, right? So, but it is always good to find somebody that you feel you can open up to, discuss, and people around should also help in a way to not be too careful. At times, people kind of want to thread carefully. They feel like, we don't want to raise this issue, or we don't want to discuss this issue here because this person is here. We don't want to have to feel somehow. Please, just be as normal as you would talk, because it actually helps the person to fit back into the whole group. Don't kind of say, oh, I don't want to discuss this issue because this person is here. We don't want her to feel bad. The more I usually tell, like I do talk to somebody, I said, when something happened and you own it, it reduces the strength, or it's the power of people using that thing against you. So when things happen, as much as we want to be considerate of the person, we also want to make that person feel comfortable in their own skin. So let's just talk as if the person is just part of us. It helps the person, to speak out more, to come back into the community step by step. So talking is actually therapeutic, yeah.
It is, yeah. Absolutely. I mean, a big fan of that, So I'm glad, this sort of like, help in a way, because sincerely, that was my, intention to actually bring attention to grief, the impact of grief on mental health. So on that note, I want to thank you so much, for being part of today's episode of Public Health Talks series, and I hope one of these days you'll be more than happy to come back on the show to share some of your volunteerism experience or whatever it is that you want to talk about on the show. So again, thank you so much, for shedding light on the important topic of grief and mental health.
Thank you. I'm glad I came.
Yeah, I'm really glad that you're here today too. Yeah.
All right.
My regards to the family. Thank you so much.
Definitely. Thank you. Bye.
Right. I want to thank Ms. Risqat for chatting with me today on the impact of grief on mental health. So on that note, if you have any public health topics or you want to appear on the show, that any public health topics that you want me to shed a light on, or you want to appear on the show, please feel free to send me a DM. I'll be more than happy to take a look into that. And until the next video, continue to practice the preventive measures in place and stay positive and stay safe. Thank you guys so much. Bye.